Fall is right around the corner, and that means there is plenty of time to still spend in our beautiful outdoors, but we still have to think about the pandemic. Joining me now is Associate Medical Director of Sports Medicine at Intermountain Healthcare, Dr. Anthony Beutler. Thank you for joining us today, Dr. Beutler.
Thank you, Carrie. A pleasure to be here with you today.
Yay. Okay, so there's a lot of misinformation about when and where to wear a mask. What if we are outdoors, maybe going on a hike or going on a picnic? Do we need to wear a mask then?
Remember that the recommendation is for either wearing a mask when you're going to be less than 6 feet or being more than 6 feet from somebody, right? So if you're going to be on a hike, take your mask with you. There may be spots on that trail. Our trails are very crowded these days. There may be spots on the trail or areas where you won't be able to be 6 feet apart from folks. So wear your mask, put it on then. But if you're going to be out on a bike ride where you know you're going to be far away from folks more than 6 feet, you don't need to wear a mask for that. But try to keep that in mind, that you should be either more than 6 feet apart or wearing a mask at all times.
Okay, and winter sports are actually coming up. They're going to be here before we know it. How can we prepare for those when we hit the slopes?
Sure are. We get that question a lot. And I think the most important thing is to start to prepare now. Now is a great time to do what these folks are doing that we see there. Get out and walk. Get out and ride your bike. Get out and use those mountain trails that we have so many of here in Utah that are so great. Lift some weights. Get some things going so that you don't hit the slopes for the first time without having exercised before. So start your training now so that you can be prepared to excel in those winter sports when that time comes.
Okay, and no one wants to get injured and end up in a hospital right now, of course, during the coronavirus pandemic. What can we do right now, doctor, to prevent injury?
Well, I think that one of the most important things to prevent injury is just to remember that we want to go slow at things, right? So if you're going to work out and you're going to be doing something, warm up first. So take those muscles that are cold and stiff. Don't stretch them right at the start. That's like stretching a cold rubber band. It's going to cause some injury. But go ahead and start with a slow walk, then kind of go to a slow jog. Move your arms around. Warm up before you start to exercise, and save that stretching for the end. Those things will be helpful to you to avoid injury and to allow you to enjoy the activities that you have. Look for things that are lower impact. If you haven't been active for a while, try some biking, try some elliptical instead of going right out and hitting like a 5-mile run. So ease back into things would be helpful. And if you do get hurt, don't wait. Now's a safe time to get medical care. Our facilities are open and you can come before things get too bad. Don't wait for things to get worse.
Okay, that is important to remember. And doctor, what injuries do you mostly see and how can we prevent them?
We see a lot of sprained ankles. We see a lot of sprained shoulders, sprained knees, those things. And those are just from kind of overuse type things, from going too fast too soon. So make sure that you're easing back into your activity. Make sure that you're doing things that your body's kind of used to and then going up gradually from those. I think also that we can just make sure that we're safe. We've seen a lot of trampoline injuries and a lot of crazy injuries from people who are just excited to be back outside and get going a little too far and a little too fast. So just be careful and warm up and you should be okay.
Okay, great information, doctor. Where can we go for more info if we would like that?
This website on your screen looks great to me, inutah.org/healthy. That'd be a fantastic place to go for information and to find out where you can be seen if you need care from an injury that you have had.
Okay, fantastic, doctor. Thank you so much for joining us. Have a great day.
Thank you, Carrie.